Good afternoon. My name is Florence Ogunbiyi. I'm a student nurse from Durham College. I'm here to do my IV assessment. Firstly, I'm going to check the doctor's order, which says infuse IV normal saline of 125 per hour. I will go ahead and check my IV bag solution. My IV bag solution, which is right here with me. My IV bag solution. This is my IV bag solution, which says expiration date 2027 and 500 ml with 0.9% sodium chloride. Then also I will go ahead and check my drip chamber to be filled with solution up to the mark line, and so that I can be able to see how my drip fall. I will go ahead and check my IV tubing here. I'm going to check for air bubble, and I'm also checking for the kin and leak, so that if there is bubble, and I'm going to tap the pod to free the air and slowly primer out the air. Next, I'm going to check my IV site location on the left cephalic vein of the patient. I'm assessing for swelling, redness, and tape is securing and dry. Also, there is two complication on that usually be on the IV site. One is Ferabites, which is the redness, warm and painful tenderness. And the nursing intervention is to stop the drip and remove the IV line and apply warm compress. Secondly, we have infiltration, which is swelling, coolness and painful. And this time around, the nursing intervention is to stop and remove the IV line and apply warm compress. And after doing that, then I will go ahead and do my drop factor, that is, which is 10 drops per ml. And in this case, since the doctor's order says infuse 125 ml per hour, which is going to be 125 all over 60 minutes times 10 GTT per ml. And if you do the calculation will come to 21 GTT per minute. So then I will go ahead and determine when my bag is due, since I have 500 ml and I'm to infuse 125 ml per hour. So my bag is due, so that means my bag will be due in 3 hours and 2 minutes. So but they need to come prior, and also the additional I need to make sure is to make sure the patient bed is in the lower position. After doing all this assessment, after this, make sure the bed is in lower position, the core bed is within the range. Thank you for watching. Bye.